Well, the Mobile Health Lab has given us the opportunity to extend Washburn University into the community and given our students the opportunity to interact with patients in a setting which they normally wouldn't be able to do, providing care for patients and perhaps people that would not ordinarily have access. And it makes it so convenient for them for us to come in and be able to do this. So when we can extend the university into the community in a way that stimulates people to think about their health and it also provides them with some help with their health, then we've done something really special. And the collaboration with St. Francis has been really something that we're proud of, and we couldn't have done it without. You'll recognize the mobile unit that goes around town because it's got this mural painted all around the thing, and it's just spectacular when you see it. It catches your eye, and you then know what it is, and you'll remember it. And so when it comes to your area in the city, you make sure you go out and see it.
We had looked at Harveyville, Kansas before the tornado and had actually started building the program with the leaders within the community before the February tornado. So in September, we started taking faculty nurse practitioners out in the mobile unit and providing primary care to the community. And we're also taking nursing students and nurse practitioner students with us to give them an opportunity to practice in a rural setting. And going into the community and visiting with the leaders as well as some of the citizens, it's just 45 minutes for them to come to Topeka and get health care is pretty prohibitive, especially if they're elderly. So for us to be able to provide it right there, literally 2 doors away from many of these families, it's just been so beneficial. We've done well child checks, we've done flu shots, we've done lots of education, and we've just sat and talked. A lot of these folks are still going through a lot of difficulty after the tornado. So our psychology department at Washburn is working with us to do some education and to do a support group around the post-traumatic stress syndrome that they're seeing within the community. So Washburn as a whole is really able to look at a collaborative and a comprehensive level of care. We've taken a nutritionist out with us to Chesney to do education. Those are resources we wouldn't have available without St. Francis. And then of course Washburn having the different schools, bringing that team together and how can we work together to provide the community the services they're needing. Just in health screenings and the Chesney program, we've seen between 23 to 2,800 people.
Well, obviously we had a tornado hit Harveyville the 20th of February. A lot of cleanup has been completed. We're still in the process of rebuilding. I think the mobile clinic is filling a gap in Harveyville. Maybe not just filling a gap, but I think maybe it's raised the bar to a new level of what we're providing and able to access in Harveyville. One of the challenges we see in Harveyville is transportation. With an aging population, it's my belief that having the service right there in Harveyville is going to help people financially as well as with their health. This truly is a mobile health clinic with St. Francis and with Washburn, and that they're providing a very high level of experience. It's nice, it's convenient, and everybody says, boy, there are sure nice people in that clinic.
With St. Francis Health Center being a distinguished hospital for clinical excellence by Health Grades for the last several years, patients can get innovative, top-notch care here in Topeka. And the Da Vinci system is a great way for us to augment or to add to that top-notch care here in Topeka for patients.
We were one of the first programs here in Kansas to start the robotics program. When we first started it out, first in urology, mainly doing prostatectomies, which I think if you look at the current data, close to 85% of the prostatectomies done in the country now are done robotically. So we really brought the new standard of care here to Topeka early.
We have originally had machine 37 worldwide, and now there's close to 2,000 machines worldwide. And so when you look in the camera, you get a three-dimensional view. So a common example would be saying if you go to the theater and you see Star Wars in 2D, it's a great movie. But when you go to the movie and you see Star Wars in 3D, it's amazing.
You have less dissection, which means less pain, less bleeding, faster recovery time, and in the case of single-site gallbladder, less scarring. We do minimally invasive mitral valve repair surgery now, where we do not crack the sternum to get in to fix the valve. Well, it's amazing technology. It's cutting-edge technology. You'll see it across the country. Volumes are exploding with the robot. We now have an advanced level of technology with the robot, and it's right here at St. Francis in Topeka. With our increasing volumes, we needed a second system in order to take care of our patients in a more timely manner. We were having conflicts with scheduling, patients having to wait 1 to 2 additional weeks to get on the system. When you're talking about a diagnosis of cancer and wanting to have that tumor resected in a timely manner, sometimes having to wait 2 to 3 weeks was nerve-wracking for the patient.
I think we've really been a leader here at St. Francis, and by giving us an additional robot, it just it's just going to validate our program and help us continue to grow it.
The benefits was no big incision. I had 4 or 5 little tiny ones, and they seemed, of course I know inside they probably aren't as healed, but they healed up really good, and so I know it was a perfect way to do it. No pain. I mean, I did ask her about one a little on the side. She said, well, that was where she put everything, so I would have it for a little while, but no pain, didn't need pain pills, nothing like that, and it just worked perfect, to tell you the truth. I feel so much better after I've been taken care of. It's just unbelievable.
But the other thing that I've noticed as I do more surgeries using the Da Vinci system is that these patients just get back to work so much faster and get back to functioning in their normal job, their normal households, and moms are able to do things with their kids within a couple of days after surgery, and they feel like they're functioning at their full capacity quicker.
It benefits the community in a couple of ways. First of all, they don't need to travel to Kansas City, being further away from their family members during the recovery time. You don't have that additional cost with travel, staying overnight possibly in a hotel. We have very qualified and capable surgeons right here in Topeka, and the technology at St. Francis to take care of our patients at home.
And with the Da Vinci system, there's no additional fee for patients. It's all the same fee. It doesn't change anything. It just adds benefit to their healing. Here at St. Francis, with our mission being so strong in caring for the poor and vulnerable, our Da Vinci system is available to those patients like any other patient. And so we're able to provide top-notch care to anyone that comes in and needs care.
Every day there's advancements. Every day people are pushing the limits in taking care of our patients as best they can. And this is the latest tool in minimally invasive laparoscopic surgery.
I don't understand how they do all the things they do with it, but it's a very important thing, and I'm glad St. Francis has it. I just plain like the way you guys take care of people. I truly recommend St. Francis just because of that.
Thank you for attending tonight. We are excited to ask for your support of this very important piece of our mission at St. Francis Health Center.
The Ministry of St. Francis has been providing innovative care since 1909. Showing love and compassion for all, especially for the poor and vulnerable, is very important.
As you have seen, the Da Vinci surgical system is the very definition of innovative. It is very important to have such cutting-edge care available to everyone in our community. Please give generously tonight, so that St. Francis can continue to reveal God's healing love in the most wonderful and innovative ways to our community. Thank you so much.